Hi. And we're recording. So, hello.
Hi,
Who are you?
I'm Dr. Navneet Singh. I'm from India. I'm working as a director of two hospitals, one in Delhi and Mumbai. I look after the emergency medicine department. I'm a cardiac anesthesiologist by training and been working in the critical care field and emergency medicine for the last 20 years. We have pretty busy ER. There are lots of road traffic accidents wherein every second counts. The decision making is most important. The ease of decision making is another one. So any tool which is helping us taking decision fast to save life, where every second counts, especially when there is lots of trauma, lots of bleeding happening. So if we can zero in on the place from where it is happening and the place where we can see, we can plan the surgery immediately. So time is the best teacher. So time is the best denominator which saves life actually. So as fast as we do it, so there are tools which aid us doing some diagnostic tests to ensure that what exactly is the fracture status or where is the artery which is bleeding. Any device which can help us ease doing that will definitely be helpful in our management of the patient overall.
Can you tell us about your specialty? And
I'm a cardiac anesthesiologist, I told you. I'm looking after critical care for the last 18 years and heading these two department of emergency medicine and acute care medicine in the hospital in Delhi one and in Bombay two. These are all super specialty hospitals with very high amount of trauma coming into emergency medicine, and we are the first responders for the same. We also run retrieval services like ambulances and air ambulances, so lots of trauma we transport as well.
how do you use Immersive View in your field?
Well, Immersive View, we got the information about this Immersive View, which is like a virtual reality platform. It makes up planning of the surgery very easy. And we actually know exactly where is the breach in the continuity of the vessels, which usually happen when the patient is bleeding in trauma and major trauma, like motor vehicle accidents. Or sometimes the patient will coming with AV malformations like aneurysms in the brain. Or the person who comes in with multiple fractures of the brain, of the bones, which usually happen with a high-grade trauma, especially the motor vehicle accidents, the fall from height, you have multiple fractures happening in the bone. So this technology actually help us zeroing in to count the pieces, although we can do it in an X-ray, but again, this helps us in deciding the distances, how those bone pieces are placed inside the body and how far they are from each other, so that we can design the effective placement and alignment of the bones. Secondarily, we can also see the vessel status by this on a virtual reality platform, wherein actually we can see and pass through inside the vessel and see where exactly is the breach and from where the bleeder is. And we can also know the size of the bleeder because it has a very good measurement tool. So we can actually do the measurement, what is the diameter of the rent in the artery. So it becomes more effective, and we also immediately come to know whether we have to involve advanced vascular surgery or what kind of management we have to do, and amount of bleeding which is happening can be controlled just by pressures or the primary measures, or you need some advanced measure of that. So that is the help which Immersive View gives us.
Awesome. And you covered a few of the points in there. So can you give me information on the ease of surgical planning when using?
Well, when we plan a surgery, it's a big decision, especially when we're doing it with the vascularity, lots of vascular tumors. So what we do, what Immersive Touch does is that it tells you about the exact anatomical placement of the tumor, so that we cannot, and what are the basic distances from the bony landmarks, and when we go for the surgery, what all things we are going to encounter on the way. So we can one way design this, that we can choose the best possible way to reach the tumor, avoid complications of hurting other structures around. We can also know the measurement and diameters of what are the feeders of the tumor, so that we can perform the exact surgery. We do perform exact surgery in various other methods also, but Immersive Touch gives you that ease of timing So once you know exactly where you're going and what are the structures you are going to encounter, it's not a blind surgery anymore. So what happens is that you actually save the time of surgery, and you also decrease the OT utilization hours so that we can accommodate more surgeries on the same day. So this is how it helps in planning of the surgery. Secondarily, in case of orthopedics or joint replacements, we also have this part wherein we can have the exact measurement of the angulation of the bone and the size of the bone. And when you do that sizing, we actually do the 3D printing as well with this software, and then this helps us designing the exact angulation of the bone in normal circumstances. Vis-a-vis, once we remove the bone and we put an implant, that implant actually is the best implants are the implants which take the normal curvature of the body. That's why the rehabilitation post-operative is more easier, it is more effective. So that is again very immersive view touch, gives us an edge on other things. The conventional methods, yeah.
And I think you covered the saving time in there. So those were the big points we want to hit on. Is there anything else you would like to talk about?
We can design especially when in Indian circumstances where lots of oral cancers and jaw cancers are prevalent. So when we do the jaw surgeries, we do loads and it's an extensive operation which goes on for 5 hours, 7 hours, 10 hours. The main challenge is not about removing the tumor. The main challenge for the surgeon is to maintain the normal aesthetics of the face of the person, so that post-operatively it does not look bad. In that case, if we do the planning before, we take the normal CT scan of the patient, and we exactly know how much bone we are going to remove. And in that case, we also we put plates on the face when we remove the jaw. So those plates, these are planned surgeries usually. So those plates can be again 3D printed and can have actual angulation, so the basic aesthetics of the face is maintained post-operatively as well, and the results of the surgeries are excellent on that. So it also formed the gamut of the cosmetic surgery and having the craniofacial surgery also. Sometimes when you want to do lots of good craniofacial operations to approximate the jaws, so this 3D printing part gives you the exact plate settings and exactly how it will look like post-operatively. So you can have a better outcome as far as surgery is concerned, and this also makes up an ease that you don't have to plan right there to try different plates. You have to have the same plate which can be planned pre-operatively, so that makes it more effective.
Awesome. Yeah, thank you for getting into 3D printing, because I did leave that point. So
and last but not the least, when we do the measurement of the aneurysmal thickness, we can actually have just the same clip and exact dimension of the clip, so that if the clip is loose or it is small, does not have exact dimension, it might end up leaking the aneurysm and have a breakage of that. So once you have the correct clip for the correct surgery, this is the tool which can actually give you that.
awesome.
This is what it is.
Perfect. So
Anything else you want?
I think that's it. Like everything we talked